some of the features of this area being a problem is when you have jaw joint pain. So it can be in the joint, it can be in the muscles. You can just kind of feel this discomfort in the front of the ear. Oftentimes people have trouble with opening, so their opening is limited. They can even have a joint lock where they're really unable to open or unable to close. And they just have trouble with function. Chewing is an issue. Often people will get very tired with talking, that type of thing. Some of the other features that happen with jaw issues is that there's a really high incidence of neck pain, so kind of around 70%, and also ear pain. So for people who visit a TMJ clinic, for example, ear stuffiness, ear pain, or tinnitus, the ringing in the ears, is actually, about 72%. So the last thing that is pretty closely associated with TMJ issues is headaches. So there's a bigger severity of an intensity of headache pain and often an increase in frequency. And for people that have migraines, it's 15 times more likely in a person that has a temporomandibular joint problem. So, really then there's this question, what do you do? Let's say that you're perfectly fine and then you end up with this jaw problem. Or it could be that you have an ongoing problem, you're managing it, and then you get a flare-up. What to do? So the biggest thing, if we think of an ankle sprain or something like that, is to just think about rest. So how are we going to rest this area, right? That's kind of a issue. So one of the very easy things to do is to simplify your diet. And I like to talk about a pain-free diet. And what that means to me is that when you eat, you don't have pain. So smaller bite size, decreased texture. Sometimes people have to go to smoothies for a little while if they really, got a really acute issue going on. But we don't want to stay there too long. It's kind of, in the ideal, it's about 7 to 10 days of having that modified diet, and then you want to slowly increase that complexity again. So that's good for us from a nutritional perspective, and it's also good from your jaw muscles working properly. From a functional perspective, sometimes that also means that we need to decrease our talking, maybe the singing, yawning, and the functions of the mouth that are unnecessary. So clenching, leaning on your jaw, all of those types of activities. If we ease up on those, that's a form of rest as well. We want to be careful with our sleeping position. Certainly sleeping on the stomach puts a big pressure on your jaw. And if you sleep on your side, you want to make sure that your hands aren't anywhere near your face, because that, as you relax, you can imagine that gives you a lot of pressure on your jaw, and that's not helpful if you've got a jaw issue of pain and that sort of thing. And then one other thing that we can do that's pretty simple is a resting position for the tongue. So you place the tongue in where you would say the word now. So where your tongue touches, when you say now, that's where you want your tongue to rest. And studies have shown that people with TMD problems, temporomandibular disorders, have a weaker tongue. Which is kind of funny, right? But anyway, so what we need to do is we need to get that tongue further up. So keeping that as your rest position, I like to tell people to do that once an hour, and just to take a little breath in through there, do a swallow with your tongue in that position, and that just helps to retrain and strengthen the tongue so that it functions properly.